Welcome, everyone. Thanks for being with us for today's webinar. We'll get started in just a moment. Welcome all. We'll get started in just a minute. Thank you for being with us for today's webinar. Well, hi there, everyone. I am Michael Morella, Managing Editor at US News and World Report. We're here today to explore the question of how child mental health impacts the workforce. Whether you're a hospital, a Fortune 500 company, a school, or otherwise, we hope that by the end of the hour, you can come away with some actionable insights about how you can help address the national mental health crisis that has been building for some time. As a programming note, we are recording video of today's webinar, and it will be archived on the US News website. We're also simulcasting on LinkedIn, Facebook, and YouTube. If you'd like to learn more about today's speakers and some of our upcoming Healthcare of Tomorrow virtual events, I'd encourage you to visit usnews.com/healthcareoftomorrow. So now for our first segment, I'd like to introduce Marty Bledsoe-Post, Executive Director of On Our Sleeves. Welcome, Marty. Thanks for being with us.
Hi, Michael. Glad to be here.
Well, Marty, many members of our audience are practitioners who are very familiar with mental health challenges and may be dealing with them every day. To a wider public, some of the persistent stigmas around mental health are lessening. Many people recognize World Mental Health Day just the other day. Yeah. Can you talk to us a little bit about On Our Sleeves and what your movement seeks to do amidst all of this?
Absolutely. On Our Sleeves is the movement for children's mental health, making sure that kids have a voice in the mental health conversation. We focus on giving evidence-informed child mental health resources to every community in the US. That's parents, teachers, coaches, leaders, employers. And we want to do a few things. We want to break down the stigma around mental health for children, especially those under 14. We're called On Our Sleeves because children don't necessarily wear their thoughts and feelings on their sleeves. They don't have the vocabulary and the ability to tell us what they're thinking and going through the same way that adults do. And so it's critical that we as adults surround them and help them with that and start to give them some of the skills that they will need to grow up mentally healthy, just the way we would think about the skills they need to grow up physically healthy.
Great. And can you talk us a little bit about what your research show, what you're finding, and even some of the kind of compelling insights and stories you've discovered and been hearing?
Absolutely. One of the important things we do at On Our Sleeves as we interact with audiences all across the nation is we listen and study to understand the perspectives of adults, families, dealing with children and their mental health, especially over the last couple of years. And some of our recent survey work and focus group work, we have heard that parents are seeing really big changes in their kids' behavior. So they told us that they're observing more talking back, less helpful behavior at home, more nervous, worried types of episodes, age inappropriate meltdowns. So those that you wouldn't expect of a certain age of child, maybe withdrawal, not getting along with siblings, some issues at school. And when we asked parents to tell us, well, what is that like for you as you observe these things in your child? We had one mom share with us, and I'm going to read her story. I think it's really helpful to put this into perspective. She told us, "It breaks my heart. I have researched ways to work on it, joined groups on Facebook, read books on it. And in the moment, I still don't feel like I know how to deal with it in a constructive, validating way," talking about her child's behavior. She says, "I joined groups led by autistic adults to get information. I read books on the explosive child and raising human beings. I tried gentle parenting. I reassured him, whatever I can think of. My next step is to find a therapist for him." And then she adds, "It was not helpful. I'm still trying to find a healthy, successful way to best support him during these episodes." And when we hear stories like this from parents who are trying to think of the right next professional resource to reach out to on behalf of their children, it helps us to remember that 1 in 3 pediatric visits in our country is actually a behavioral health question or concern. So oftentimes parents turn right away to their family doctor or their pediatrician. And when they do that, the challenge there is that that means it takes longer than your average pediatric well visit. It sometimes can take twice as long to get through a behavioral health question. And the pediatricians aren't always reimbursed for that visit, for that mental health part of the visit. And when we think about sending a child on to a specialist after that visit, we don't have enough of them. There's one child psychiatrist for every 15,000 youth under the age of 18 in our country. So we will not necessarily be able to treat our way out of this one-on-one. And if families do reach out to a specialist, they often spend a long time on the waiting list. So from there, oftentimes the next step they will take is reach out to their school. And when we talk to educators with one of our education partners earlier this year, First Book, we heard from them that 98% of educators believe mental health challenges act as a barrier to learning, but only 20% of educators feel equipped to help their kids with their mental health and well-being. So that is a giant gap in the classroom. So what do parents do then? Well, they revert to what they know of when they were brought up, but almost half of parents we've talked to said they didn't grow up talking about mental health in their families. And if they did, it was usually with some negative stigma attached to it, some judgment. And these trends are higher among the older parents, older adults, kids with, or parents with older kids. And we asked them too, well, what is it like when you're trying to deal with an issue with your child's mental health? And 2/3 of working parents in one of our studies told us that can be very to extremely challenging for them. So we've got an overtaxed system. We've got long waiting lists. We've got schools that don't necessarily feel that the educators have told us they don't necessarily feel equipped to handle this. And you've got parents who didn't grow up with these skills in their own upbringing. And it has created really a perfect storm, which is what led us to our big study that came out earlier this year. And we called it the Great Collide because that's what we saw in the data, the Great Collide between parents' family needs and their working needs.
Yeah, you talked a little bit about this, but just kind of ask the question directly, from this research, from these conversations with all these different kinds of stakeholders, whether they're in the medical community, the education community, the business community, the policy maker or advocacy community, how are you taking or encouraging action? What are some of the ways, if you could even just spotlight a few ways that these groups, no matter what their kind of stake in this is, can make a difference or can help address or make up for some of those shortfalls, at least in the short term on the professionals front?
It's such a good question. The first thing all of us can do is talk openly about mental health as an issue, not just as it relates to adults, but as it relates to children. So every single time one of us has a conversation where we address mental health needs of children in a matter-of-fact way, we are breaking down the stigma around this topic. On our sleeves, we talk a lot about the casserole effect, which is if your child were diagnosed with a physical illness, your community would show up right away. They know what to do. They would bring you gift cards and send flowers and offer to babysit and bring you a casserole. But when your child is diagnosed with anxiety or depression or a learning disorder, that doesn't happen. In fact, people don't know what to do. And so the first thing we can all do is have these conversations more openly. In fact, right now on our website, we're running something called Operation Conversation because we really want to encourage these talks and we want people to know the right terms to use and know how to really have these discussions in a positive way.
You mentioned that website, but just for our audience members, could you say the URL for those folks?
I would be happy to. It's onoursleeves.org. If you join us at onoursleeves.org, you will learn about Operation Conversation. You'll be able to access our dozens of free resources and download some of these things for your own use. And you'll be able to see a little bit more of the data behind the Great Collide. I loved your question about action because what we want to really think about when it comes to the corporate world and employers is what can businesses do to lean in on this? And our data in the Great Collide actually showed us that working parents, we talked to almost 2,000 working parents. They said 6 in 10 said they are very to extremely concerned about their children's mental health. And when they're at work, this can take up anywhere from a third to half of their mind share. So it's something that is very concerning and distracting, but even more so, it can interrupt the workday. Half of parents told us they are coming in late, leaving early, taking a day off, or they're stopping work to go answer a phone call or return an email related to their child's mental health once a month or more often, which makes sense. Mental health concerns are a bit more sustained than, something simple like an ear infection or a broken arm. But it does indicate that employers really have a key role that they can play here in supporting working parents and engaging on this issue. And we believe it all starts there with conversations as well.
Well, Marty, we're going to be opening up that conversation to a broader panel of folks from the medical and the business communities. Do you have any final words or anything else you want to call our audience's attention to?
Well, we really hope to create a huge audience of advocates around this issue. And so we appreciate everyone who's listening in and leaning in on this. And we will be following up. Hope you'll all stay tuned to the work of On Our Sleeves, because we have some resources we have in mind just for working parents and employers that we think will really take a big step forward in how we can address this.
Wonderful. Thank you so much, Marty. Now I would like to open up the conversation and introduce our panel. With us today, we have Dr. Yusra Ben-Halim, Senior National Medical Director with Optum Behavioral Health Solutions, Vanita Clements, Executive Vice President and Chief Human Resources Officer for Nationwide, and Dr. Ariana Howitt, Clinical Director of On Our Sleeves and Clinical Assistant Professor of Pediatrics in the Department of Pediatric Psychology and Neuropsychology at Nationwide Children's Hospital and Ohio State University. Welcome to you all. Thanks so much for making the time. And now I'll turn it over to Morgan Felchner, Executive Editor at US News, for leading this conversation. Morgan?
Thanks, Michael, and thank you so much, Marty, and all the other panelists for being with us today. It's such an important issue, and I really look forward to our conversation. But before we dive deeper, I want to hear from each of you. Could you each talk a bit about your role, your institutions, and how you and they are supporting child mental health? Dr. Howitt, why don't we start with you, given your role with On Our Sleeves?
Sure. Hello, everyone. I am Ariana. I am a pediatric psychologist, and I work in primary care. So as you heard Marty explain, we know that 1 in 3 visits to a primary care doctor is for questions related to a child's behavior or mental health. And so I'm there in clinic to meet families the moment they ask those questions and increase access to a mental health professional. And I joined On Our Sleeves as the clinical director, because I think it's really important that we're getting out evidence-based information in the hands of every adult that has a child in their life. So my role as a clinical director is making sure that the content, the resources, and curriculums that we are putting out there as an organization is based on the evidence and based on what we know works for children's mental health.
Thank you. Dr. Ben-Halim?
Thank you so much. It's a pleasure to be joining you. My role is at Optum Behavioral Health Solutions, and as a child psychiatrist and addiction psychiatrist, I get the incredible opportunity to work with such talented people in all kinds of different teams, multidisciplinary approach. And what I get to do every day is we really take a step back and look at the country at large, and we think about how do we improve access to care? How do we help people get care that works, that's evidence-based? And how do we make that experience as seamless and human-centered and human-focused as possible? So I get the incredible opportunity to work with providers and clinicians across the country when we think about expanding our network. We also get to think about products and solutions. There's been a lot of innovation in the behavioral health space in the past few years. So getting to take a deeper dive and looking at what people are building and making sure that it actually works, and then trying to understand, well, who is this solution really for? Who would it best serve? So I get the incredible chance also of joining folks like yourself and being able to continue to have these conversations at a broader level, because I think continuing to really reduce stigma, to help people build that language, have that awareness, that's another key aspect of my role that, again, I'm just very grateful to have the opportunity to do.
Thank you, Dr. Ben-Halim. Now, we know that the problem is twofold, and we're here to talk about both sides of this, both the treatment and how we handle the actual treatment of the children and how companies respond. So Vanita, can you tell us a little bit more about your role?
Sure. I am Executive Vice President and Chief Human Resource Officer for Nationwide Mutual Insurance. We have been a long-standing partner with the Nationwide Children's Hospital. We have provided over $140 million from the Nationwide Foundation, starting way back in 2006 when we provided a $50 million donation. The On Our Sleeves initiative is critical. What we have found, and especially in my role as being, responsible and cultivating and evolving our culture, what we have found through the pandemic is that many individuals have reflected. Family matters are much more important to the associate. And it is no longer okay just to be concerned with the work experience of an associate. So we have to consider the whole life experience, which involves our children. And so the work that On Our Sleeves is doing has been critical. We are glad to be a part of the initiative and helping fund to do the design and research of this effort. I think that businesses have to play a part. When our associates feel good, the work is better, they're more engaged. And for many parents, we all know that when our child is sick or ill, it does take mental space during the day. And so whatever we can do to help promote resources and tools to help associates, we're all better for it.
Absolutely. Now, we all know that there's not a silver bullet here, and collaboration and community partnerships really seem key. Can you speak to that? What roles can and should children's hospitals or other systems, payers, public health officials, and health leaders across the industry play in coming together around the issue? Dr. Ben-Halim, would you like to start? Oh, sorry. Go ahead, Vanita.
No. Go ahead. I thought you were talking to me. Go ahead, doctor.
Thank you. So I think we've all been trying to solve this problem for several years, and it's become much more of a shared priority in the past several years. I think now more than ever, I truly believe that in order for us to make the transformative change that we need to make, we have to do it together. So I think the role and the scope and the way in which we all do the great things that we do has changed. I think the time has really come where we have to kind of break our silos. We can't think about solving the problems in our own communities and our own little bubbles, that we have so much to learn from one another, that we have so much to optimize from the strengths and the years of work that have already been done by others. And now the time is to come together and say, how can we learn from each other? How can we have a much bigger impact if we were to do this together, if we were to have shared goals, a unified direction? And I think there's a lot of excitement about that, but I think it's just sort of not the way in which we're used to working. We're used to sort of getting comfortable and succeeding in, again, our own scope and role. And so what I get really excited about is the opportunity to really bring people together from different places, different silos and different expertise, and to say, how can we potentially get more out of these wonderful resources? How can we have that multiplier impact if we were to come together and start to have more synergy? So I think all the people that you mentioned, Morgan, it's now about getting everyone a seat at the table and continuing to sort of open these conversations about how can we maybe implement things differently? How can we find synergy where perhaps we have sort of independent work going on?
Dr. Howitt, any thoughts?
Yeah, I completely agree with that. I think historically, if we look back in healthcare for children, we've kind of treated the child in islands. Their physical health is treated in the children's hospital, in the primary care office. Their mental health is treated in the mental health clinic, or psychologist or social worker or counselor. And we're getting to a place where we're realizing the importance of looking at the whole child together, working as a healthcare team. We can't treat one or the other if we're not together. And so the integration of mental health professionals into the healthcare system is very important. And I think where we're moving to more and more. And as Yusra said, there's a lot of excitement behind that too.
That's a great transition to my next question, which is partners outside of the traditional healthcare arena, like schools and businesses and other community entities. And Vanita, I think this is where you come in. How can companies and businesses support the whole employee, just like the healthcare industry is supporting the whole child?
Yeah, absolutely. And I think that this is where corporations really do have influence. And when you think about just the partnerships from the schools, from the different nonprofits throughout the city, what I have often thought of is we have associates in a workplace or in a work environment, whether it's at home, in the office, 10 hours sometimes a day. And so we have to be able to cultivate that time and provide education, excuse me, awareness, reducing the stigma around mental illness and child mental welfare. I've noticed that during the pandemic, there was times of seclusion where people aren't as transparent. And so we have to look at different modalities to have the conversation. And this is where partnering with different organizations across the country that can be able to help. I believe in having a seat at the table and making sure we have all of the right partners, because there is more impact with the number of people having this as an initiative and a focal point.
And may I add to that, Morgan? I think there's also been a shift where we've realized that we need to continue to kind of improve the healthcare system itself, like Dr. Howitt was saying, but like Vanita is saying, there's a life experience as well. And so it's important that we kind of integrate in the healthcare system and we fortify that infrastructure. But if we only look at the healthcare system, then what we're saying is we're waiting for families and children to come to us when they need care. And if we are able to actually think bigger than that, we think about that life experience, we think about that human journey. I like to sometimes think about it as the people, places, and things. Mm-hmm. So when we're thinking about children, when we're thinking about adults, who are the people, what are the places, and what are the things that they're coming into contact with in their daily lives? And how do we start to get really curious and think differently about those as opportunities to make connections, to really improve the quality of their experience as a human being in their life, and think about integrating that kind of perspective of that whole person, their emotional, psychological health, their physical health, but not doing it contingent on needing care, and really thinking about the connections with an employer, with our colleagues, with our communities, with the schools, is how do we start to look at all of these and make those intentional connections such that we're really thinking about supporting each other in our lives. Mental health is a part of that, and it no longer really belongs just, I think, in the healthcare system.
I love that. And I have to add, because it is a prime example of what the doctor has just articulated. We had an associate who attempted suicide. She called us when it failed. And it struck me that instead of a family member, instead of ER, the hospital, she called nationwide. And I felt that is a prime example of us all working together. We quickly got her into, the medics. She was in the hospital. She was she's doing better now. But the whole point is she called her employer. And the reason I think she called her employer is because we have such dialogue about it. We have nurses on standby. I think that there was just a transparency. And for me, that was a prime example of us all working together to save lives, not just of the children, but our parents and associates as well.
That's a fantastic story and a great example of the work that you're doing at Nationwide. Now, I want to take this opportunity to really get down to some of the details and talk about the things that you have done and what employers can do to best support their employees so that other places have experiences like that, where, I mean, hopefully we're not having a lot of people that are attempting suicide and then calling their employer. We're not getting to that point, but what are some specific things that employers can do to support employees and employee parents and their families?
So one of, if someone were to ask me, what is the foundation and the pillar, and it is a listening and awareness strategy. We have been very vocal about our associate well-being. So we have an associate well-being organization. We do Mindful Mondays, Wellness Wednesdays, where we're focused not just on mental health, but emotional, physical health as well. We have increased our counseling services where, it's the employee assistance program. We used to have like 8 free sessions that an associate have. Understanding that there was a need for more, we increased that to 16 sessions now for their families as well. We also invoke on the listening strategy, which I like to say it's active listening. It's also listening with the heart. As we can sometimes read in between what people are saying, I think that goes a long way. So we have increased that across the organization, from our CEO having coffee chats one-on-one to leaders just talking, how are you doing? Whether you're working from home or not, we're connecting with them. We also have associate resource groups, which have been instrumental. It is a support mechanism. So people who have like interests are now able to connect with each other, whether it is from a demographic, culture, activities association, but just like minds where you have support and you feel like you can talk to people who really get you and understand your passion points. All of those things work. And then I think just with the coordination and the design of Bloom, which is resources and tools for caregivers to provide, how can I talk to my child? If I sense something's wrong, and I would say a parent knows their child better than anyone. And so if you feel that there is something there, certainly always talk with your doctor, but these resources provide a way to start conversation and give different resources to caregivers. So those are some of the things we've done. And I think lastly, I would say being innovative around benefits. We have oftentimes not thought of mental health the way we should when it comes to benefits. And we have now started to do that, so we require our vendors to give us, how do we make sure that we're helping people with brain stimulation? And how do we make sure that disability and mental illness time off work is managed in a way where it's not as frustrating? Because I think one of the doctors had mentioned before, instead of going to this doctor for that and another one, let's look at it at a holistic approach, giving an intermediate to just have the associate have one single point of contact. So putting more innovation around how we look at mental wellness with our benefits has also been very helpful.
Thank you. Now, we all know the pandemic has certainly exacerbated many of the mental health challenges and concerns. We've probably all seen it firsthand, but are there programs that existed pre-pandemic that proved especially impactful or helpful from 2020 on? And then after we do that, I'll actually ask about programs that came out of the pandemic or lessons that we learned from the pandemic.
Mm-hmm. So we did. I think the Associate Assistance Program has always been a cornerstone. Just having the ability to have therapy, consultants talk to you about personal needs, that has always been a part. We've increased them after the pandemic, but those programs worked. I would also say that the ARGs have actually been a cornerstone as well. They started more in the diversity, equity, inclusion space, but they quickly went into just a support mechanism that, so if we have a group of people who are constantly, working and talking to each other, it is actually amplified connections a lot more. So I think those have always been in place. Our benefits are strong in this area. But I think what has happened since the pandemic, to answer the second part, we typically used to hear from our associates once a quarter. We would send out a survey. How are you doing? Are you able to do your best work? And some of those questions would indicate whether there's a problem or not. We have now decided we need that more rapid. We need it every day. We need it instantaneous, and we need to be able to hear from our associates in real time. So we started a Be Heard tool. And I tell you every day, there are lots of comments, what's going well for us, what they would like to see different, what problems they may be having. And so it has really helped us enhance. A lot of times organizations will have great products, great services, but some associates still don't know about it. And so we have to often remember, one time does not negate communication. So you have to constantly, allow people the opportunity to say what they need and then reinforce sometimes what you already have. But that Be Heard tool has been essential in us hearing what's on the hearts and minds of our associates.
Dr. Howitt, would you like to talk about it from a clinical perspective?
Yeah, I think it's a great question. I look back at pre-pandemic, we already had data from the CDC telling us that children's mental health was taking an alarming trend. We had data from 2009 to 2019 showing us increase in depression and hopelessness, suicidality. And the pandemic just exacerbated that. And so I think that being able to continue to have conversations like we've been saying today about children's mental health, the importance, being aware that children can experience mental health concerns, because I think a lot of adults sometimes are still surprised, maybe less now because of what we've experienced with the pandemic. But that's where I'm seeing a change. I mean, you mentioned what have we seen post-pandemic, and that's the change I'm seeing of we're a little bit more aware now. And so there's more of that, parents asking for that information, caregivers asking for that information, teachers asking us, how do I support the mental health of my students? And so I think now we're at a great place to start talking about it and giving those resources that people need.
And I think that's a great point. We've done several webinars and lots of stories about mental health in the pandemic. And if there's one thing that I've heard every single time, it's that the children's mental health crisis predates the pandemic. It was here, and it was only made worse from all the stuff that was going on with the pandemic. Dr. Ben-Halim, any thoughts?
Yeah, so agree wholeheartedly with that point. And I think one other shift I've seen is I think more people are aware of some of the community resources that were available pre-pandemic, like NAMI, the National Alliance on Mental Illness, the Trevor Project, the local grassroots sort of organizations. I think part of what shifted in the pandemic is not just knowing about them, but people raising their hand and connecting with them and exploring them. And a really big shift with the program evolution is where those programs now live, which I think, like Vanita is saying, they are taking up a very appropriate space in our employer-employee relationship. So, before pandemic, I think it was not as common for people to trust that the workspace was not just a psychologically safe space, but a brave space where they could say the truth as to why they needed that sick day, why they may be distracted, what it is that's on their mind. And so I think it's important that we recognize that where people are having these conversations has changed a lot. And that has put, I think, a new responsibility on the shoulders of the people who are leading these spaces. So I never take it for granted that the people teams and, the HR leaders that are educators, they did not go into careers that focused on mental health. They did not want to be mental health clinicians, otherwise they would be in that clinical space. And so I think one thing that I'm learning and staying curious about, but also advocating for, is that where people are having these conversations has shifted. And we can never take it for granted that even when we have brave and responsible leaders in employee spaces who are creating all the wonderful solutions that Vanita outlined, that we ensure that they and also our school staff are really getting the support from the experts, getting that guidance, getting that leadership from people like Dr. Howitt who work with patients every day, such that we are really fortifying the individuals who are taking those calls, like Vanita said, and that we're not putting the burden and the scope of becoming healthcare clinicians on them, but we're really partnering with them so that they can learn the skills and the language and become expert noticers, and then be able to connect people with the solutions that are now being offered. I think another part of the program that's changed is we're no longer throwing things at employees. We're not just saying, excuse me, that we're going to expand the scope of the solutions, the benefits, and here kind of, choose whichever works best for you. I think there's been a lot more interest in looking at the data to sort of see when employees are offered solutions, do they actually engage? What does that utilization look like? And if individuals are not engaging with a solution or it doesn't work for them, how can we learn more about what needs to change? And sometimes it's very practical. Employees don't have the time, right? They're at work full time and then they go home and they're full-time parents. So how can employers also work with employees to carve out dedicated time to interact in these spaces, to utilize the solutions, to have the time and the means to be able to learn more about EAP and resource groups? And so really kind of thinking practically about all the different levels that are involved now and ensuring that we're really supporting and promoting an awareness and a literacy and a skill building for every person who has maybe a different role in that experience.
All of you have mentioned teachers and schools in some respect or another. We know that they're now asking for more advice on mental health, and they're noticing it, and certainly all of us in the general public are more aware that of the mental health crisis that is going on. But what are some specifics in how you can actually support schools and teachers and administrators in all of this? They, as you said, Dr. Ben-Halim, they're not mental health professionals. So what are some specifics there on how you're supporting the schools and the teachers?
I can jump in here. Something that Dr. Ben-Halim said earlier was we can't wait for families to go to clinics, right? We have to meet them where they're at, and educators, teachers, principals, they're in the front lines. They're seeing things in children maybe before the families are. And also we can't expect them to be educators and mental health professionals, right? It's really hard for us to ask them to do two jobs. So we definitely need the mental health professionals in the schools, and also be able to give the resources the teachers need to give them an idea of how does trauma show up in the classroom? How do I talk to children about their emotions? How do I help them calm down? How do I help them build relationships, kindness, inclusion? So it's more about giving them the tools and resources to destigmatize the mental health conversation and help support their students. Think about what school systems and rules are in place that maybe impact some students more than others because of their mental health or trauma history or development. And so that's a little bit of where on our sleeves we have curriculums that teachers can download for free, and it teaches them those strategies to talk about emotions, normalize it, build that inclusion, and also give the teachers the tools to maybe build a calm down corner in their classroom so that the kid can take a break when they need to calm down versus being sent home. And so I think it's a balance of giving the teachers the tools that they're asking for, and also trying to continue to integrate those mental health professionals into the schools too.
Vanita, you've talked a lot about the culture at Nationwide and the culture that you're trying to build. Can you point to some specifics of the role that human resource professionals and benefits administrators should have? I don't know that they do at many companies yet, but what roles should they have, and what things should they be doing in order to have a real impact?
Sure. For Nationwide, we've always had our values as the North Star. So our company mission is to protect people, businesses, and futures with extraordinary care. People are first. That has always been our mantra. So when we say we value people, that is really embedded in our culture. What we have to do is make sure that our behaviors exhibited every day and how we talk to each other, how we talk to our customers. And so feedback has been the most critical piece, I think, that any HR executive needs to have a firm understanding and reliability on receiving feedback from their associate base. I've always said, if you ask them, they'll tell you, but you've got to be able to do something with it when they do tell you what they need or what is a deficit for them. Most of the time, feedback can be very positive as well, so it can be validating. But I'd say making sure you have a strong mechanism of feedback from your associates. Secondly, I'd go back to the point around benefits administration. In that feedback, people generally tell you what they need. You know, for us, it was just different parts of the healthcare plan. And so we really did go to the table with administrators saying, can you provide this? How does that look? What are the dollar amounts that are implicated in that? So it matters when a CEO and an organization also lives that value of we value people and are willing to put the dollars necessary into it. So I'd say that the HR leaders have to be the conduit for our associates to provide a culture that everyone can thrive in.
Thank you. So somebody said at the beginning that there is a shortage of mental health professionals and limited resources in this area. This is something that we've seen time and time again, and I've talked about in nearly every webinar that we've had on this topic. So can we dive into that a little bit more? Is there enough supply to meet the demand from young people and families, and how do we fix that problem?
Sure. So even before the pandemic, we knew that there was a shortage, and there continues to now be a shortage because there has been such a surge in demand. I think there are lots of different parts to how we solve this problem. I think there has been a lot of national attention. There's been a lot of government sort of declarations that there will be money going towards solving this problem. Just earlier this month, the Safer Communities Act announced that there would be hundreds of millions of dollars really dedicated to improving access to school-based mental health clinicians, and then also focusing on how do we improve the pipeline. So kind of two parts. What do we do now in the current state, and what do we do to get more providers in this space? I think one thing that I've seen is thinking differently about how we optimize the value of the resources that we have. So when we think about behavioral health, there are all different types of licensing, credentials, expertise, and more people within the healthcare system are taking a closer look and saying, but when do we really need the psychiatrist to be involved, or the therapist, or potentially a case manager? And how can we think more holistically about that young person and the family's journey through their healthcare needs, and start to really think about when we plug and play, how do we build sort of a team-based approach that really optimizes the sort of scarce resources that we have, all the while making sure that the care that is being delivered is really working. And then also thinking about how do we bring people together who may not have been communicating in that collaborative model, how do we bring them together to do that? So in addition to thinking about behavioral health, like Dr. Howitt was saying, how do we build better collaborative models between pediatric physical health and pediatric mental health care providers? And I think, Morgan, it's complex, but it's very doable. Again, if we come together and say we need the infrastructure, we need the payment models, we need the identified subject matter experts. So we kind of need to identify the who, the what, and the how. And then we need to start putting that out there in the real world and making it scalable and making it sustainable, because we also can't afford to burn out our providers and our clinicians who are already kind of overwhelmed and trying to really meet the needs of the crisis on the front lines. The other part is, how do we get more people excited about going into the behavioral health space? So as a child psychiatrist, I was one of few not a lot of physicians chose or had the calling of psychiatry. And then when you took it a step further, not a lot of them went into child psychiatry. So how do we think as far upstream as possible to think about expanding and really incentivizing and getting people excited to come into the behavioral health space? And then again, how do we build the infrastructure? So we need more places and residency training programs. We need more programs, and then we need more teachers for them. We also want to keep in mind diversity, equity, and inclusion. We need more providers and clinicians who are really from communities of high need, who understand what it's like to be a child growing up in a certain zip code. And we need to support more intentional diversity of not only building a bigger pipeline of future clinicians and providers, but building a diverse and I think appropriate pipeline that is truly going to be able to serve the people in a way that makes sense, in a way that is equitable, and in a way, again, that is really based in that community where they can really collaborate and connect with the community in a way that has meaning.
Dr. Hoet, I see lots of nodding and agreement over there. Do you have any thoughts to add?
Yeah, I mean, I appreciate Dr. Ben-Halim just took a very complex question and really outlined so many good steps. And another area we talk a lot about it on our sleeves is that we sometimes have to also think about maybe we won't have enough mental health care professionals to meet the need. And so we also have to start thinking upstream, the prevention programs so that there's less of a need, the promotion programs, we have well child visits for children to try and keep them physically healthy. We need to also start talking about how do we keep kids mentally healthy. And of course, you may eat all your vegetables and do all of your exercise and you still get sometimes physically sick. And so sometimes you'll still need that therapist. You'll still have a mental illness no matter what you do. But still, I think we have to start talking more and more about arming the adults with the tools that they need to help their child build those habits that are going to help them be mentally healthy, resilient in times of stress, and so that we also decrease the people needing the services.
Thank you. Next, I'm going to ask each of you to put your sales hat on. I think we'll start with Vanita. But how do you make the case to employers or shareholders, boards, funders, any other decision makers that it's important for individual and family well-being, but also for reducing stress on parents, and it's something that really needs to be invested in? And I'd love to get a take from each one of you. So we'll start with Vanita.
Sure. I think it was earlier we talked about one of the stats where if a parent is going through a situation with their child, how it causes absenteeism at work. So one, I think I'd start with it's the right thing to do, to invest, to be a part of a solution to help our children. They are the future. As it relates to our associates, I would say it is the same business case for us, engagement. It's the same business case for diversity, equity, and inclusion. When you have an associate that is able to do their best work, they deliver better service to our customers. They are more productive. This is a win-win. I can't imagine how any organization would not want to be a part of something that is so significant to the bottom line of the organization. So I think that one, it helps our overall community. Number two, it helps the organization be productive.
Dr. Ben-Halim, you want to go next?
Yes, you probably saw me nodding. I agree with all of that. And, one way I also have come to learn to think about it is that I think there's been a shift in how we think about our employer as employees. People nowadays are thinking about when they come to work, they're coming to a relationship. People have a relationship with their employer, and an employer has a relationship with their employee. And so this is important because the healthier that relationship, the healthier the work community, the better the outcomes for everyone, right? When people are healthy and happy and able to feel like they belong and they fulfill a purpose, when they believe that they can trust their employer because they're in a relationship with them where the employer actually takes action to support them, they're reliable, they follow through, then all of that translates into everything Vanita was saying, productivity, absenteeism, showing up, but also the interactions between people at work. So not just thinking about the work they do, but what is that work experience and how much of the work sort of experience and culture is impacted by the way we feel mentally, physically, emotionally. I think one other thing that I have been so excited to share with employers when I speak with them and people teams and HR teams is that this is also worth the investment because young people are the future workforce. So when we think about supporting our workforce now as caregivers, as adults who have families, we're also thinking about that secondary investment, which is that we all stand to gain some benefit from really investing in the mental health and the well-being of young people, because young people are going to be our future workforce, and young people are going to be our future leaders, our future healthcare professionals. And so one day into the future, employers will be meeting these young people when they come to apply for a job. And so again, just huge impact here and huge sort of value, I think, and opportunity to make a difference, not just now in the years that we are the workforce, but long into the future as well.
Dr. Howitt, your turn for the pitch.
Yeah, I mean, I can't say it better, but you know, one of the things that is great, Marty mentioned earlier about our Great Collide study where we talked with working parents. And so we have the data to back up what Vanita and Dr. Ben-Halim just said. You know, we have data that shows that 6 in 10 working parents are worried about their child's mental health. And half of those parents say that they missed work or they left early or work was interrupted to answer a phone call due to something going on with their child's mental health. And interesting, even the parents that said, I'm physically there, 30 to 50% are saying I'm mentally not there, right? So we know, as we just heard, that when a child is not well, the parent's not able to be at their best. And so it does matter. And we also hear from our working parents that they want their employer to offer benefits that help with their children's mental health, whether it's something like Bloom, where they get to learn about their child's mental health and how to support it, or the therapy benefits. But employees are looking for those benefits when they're looking for their job.
Well, I'm sold, and I hope that this was helpful for all the healthcare and business leaders that we have in our audience today. So let's move on a little bit. We've talked a lot about the types of programs and the types of things that we should be doing and that businesses and caregivers should be doing. But how do we define success and how do we measure program success for all those programs? Dr. Ben-Halim, any thoughts?
Sure. So I'm a big believer in reminding people that we can throw out the best solutions that we think are going to work. We get really excited about innovation again in the behavioral health space. But at the end of the day, what's actually happening in the real world? So I'm a big believer in looking at engagement. So looking at the data, how many people are actually utilizing these resources? And being honest, a lot of people say, you know, we just kind of count how many people sign up for it. But that doesn't tell me how many people continue to use a service or a solution. So being, I think, brave enough to say we need the data. We need to look a little bit closer and sort of see what are people doing with the solutions, how long are they having sustained engagement, getting curious about why or why not, and then defining your metrics for impact. Defining metrics for impact is very important because we need to be able to measure how is this actually helping this person in a meaningful way? And those metrics can look different for different employees and different cultures and sort of different community groups. So not just thinking about medical and behavioral health metrics, but also looking at quality of life, looking at people feeling fulfilled in their purpose, looking at this sort of sense of belonging, because we know, especially for young people, that's really important to their overall psychological health as well. So defining sort of the metrics, looking at things long term. I think that's another kind of recommendation from me. I think when benefits roll out, when it's a new year, we get some traction, we get some awareness, but what happens over time? Are there patterns that we can also kind of learn about by tracking data? And all the while going straight to the employee, like Vanita said, really asking people. And I think asking types of questions. So when we ask for feedback, the feedback that we get is largely defined by the question we ask. But if we start to think differently about, once we create that safe or brave space, can we ask questions that are a little different, that might get people to tell us something that they wouldn't have before about why a solution worked or did not work? And really kind of collaborating with our employees to sort of learn more about what were the barriers in every step of the way when people stopped engaging or when people thought a solution didn't work. So I think just getting very curious, but all the while kind of developing a plan that's based off of data, based off of the defined sort of measures of success, and thinking outside of the box of just the workplace or just the healthcare system, and thinking about other measurements that really help us understand the meaningful impact that a solution might or might not be having.
Dr. Howitt, any examples from on our sleeves of successful things, any anecdotes or data or anything that you can share?
So right now we are looking at our Bloom program or digital curriculum for working parents, and we're looking at our parents feeling more self-efficacy. Do they feel that they're better able to respond to their child's mental health needs or behavioral needs? We're also looking at the presenteeism. So do you feel like you are more present at work and better able to focus? And then down the line, we're having discussions of more of the impact that we may be creating in the home. Are we able to help the parent through their behaviors better respond to a child's behavior, better respond to their mental health needs? Is the communication and relationships improving? Are they advocating more for their child in the school? And so looking more at those impact measures in the workplace and then in the home too.
Great, we are running fairly low on time, but I do want to get in one more question. Our audience is healthcare leaders and business leaders, and I wonder if you have any advice for them on breaking stigmas and building awareness. Vanita, would you like to start?
Sure. I think it's kind of coupled with the last question for me, in that watch the data. The data is very important. It's telling. Things like your engagement result. We came off of the highest engagement result we've ever had. And I think that is due to the transparency and communication. Communicate, communicate, and communicate. That builds awareness. It builds trust. And I think some of the advice just around making sure, again, that you have proper feedback mechanisms and look at your data to tell you where you need to go from a trend perspective.
And before we go, I want to give each of you an opportunity to give me some final thoughts. So is there anything else that you wanted to share that you haven't yet had the opportunity, or any final words you want to make sure that our audience knows? And Vanita, we can start with you.
Well, I just want to say thank you to everyone here on this call. I think this is such important work. Bringing awareness to this type situation is really holistic in its approach and helping all of us. And so I appreciate that. Again, I would just ask everyone listening to understand where you can play a part. Being an advocate and being able to actively listen to someone and then direct them to the resources, I think goes a huge way. This is not a one-person situation. We all can play a part in making our community and our children better.
Dr. Ben-Halim, any final words?
Yes, I just, it's not a one-size-fits-all. So even with stigma, when we think about solutions, when we think about conversations, to just stay very flexible. We're all human beings. We've all had different experiences in life. And so to just stay very flexible and open-minded, that even when you think you're making progress, you may not be reaching everyone. And to stay curious about that. And like Vanita was saying, to be, I think, compassionate towards yourself. You don't have to fix it all. And I think I like to remind people that you don't have to do it alone. So to really kind of understand, how do you want to make an impact, and who are the people who can help you get there and be successful?
And Dr. Howitt.
Those are hard to follow. I'm grateful that we're having these conversations. And as I mentioned earlier, I hope that even as we get past the pandemic, the conversation continues, that we are aware that children's mental health matters, that mental health diagnoses 50% of them start by the age of 14. So we have to continue to advocate for children, and that happens at home, in the schools, in our communities, and in the workplace. So I'm super grateful for this discussion today.
Thank you so much for joining us. I think this was a great discussion and uncovering some very important facts. But that's all the time we have for today. So thank you to the panelists and to the audience for joining us for this important conversation. To learn more about mental health, check out our coverage at usnews.com or tune into another webinar at usnews.com/events. Goodbye for now.